My name is Dermot Power. I'm a consultant geriatrician at the Mater Hospital in Dublin.
I'm Eamon Brazel. I'm a consultant in emergency medicine.
In my experience of dealing with patients, the single most important thing from their point of view is not to attend hospital if they can possibly avoid it.
As emergency medicine and geriatricians, we're defined by what we can do, not where we do it.
So eHealthwatch is a novel concept in care. Essentially, we try to provide hospital-level care at home. Within a hospital environment, patients are monitored with blood pressure checks, oxygen saturation checks, weights, pulse monitoring, etc.
Well, much the same thing can happen in their own home, where measurements take place about their clinical condition. That information comes back to us and we make our own decisions based on the information that comes back. So in essence, you're offering a hospital level service, but without the requirement for the patient to have to be in a hospital bed. So there are three levels of care that we provide. The first is for those who are living independently, who have chronic disease, and we try and manage that with them. And then there's the service for people who have home care already in existence, and we add on to that. And the third level of care is patients who are transitioning from acute hospital, quite unwell, who may or may not end up in a nursing home, but we provide a whole array of services to mind those patients.
The equipment involved here looks very high-tech. It's merely high-tech in order to allow us to monitor people from a distance remotely.
So for example, a patient may have heart failure and a respiratory condition, and in those cases the carer may well measure their oxygen saturation, their blood pressure, their weight, and they'll automatically upload onto the computerized system which transmits the data to our station, and we can intervene as and when required.
We either invite the patient in to be seen in an outpatient setting, again avoiding the emergency department, or more appropriately in many instances call out to them to try and address the issue, see them in their own home and adjust things as appropriate.
The idea is to deliver personalised care to patients who are vulnerable, old, who have chronic disease, and see can we manage those conditions better in their home.
The aspiration in developing this service was to allow patients to feel comfortable, to feel safe, to feel secure. Where do they feel safe, secure and comfortable? They feel that in their own homes. And if we can provide into their homes the level of care which we would to date have to require them to be in a hospital or a nursing home, we should be doing that. That's where they want to be, that's where their families want them to be. And if we can help them to achieve that, we should be doing it.